What is up, you guys? Welcome to my channel. For those of you who don't know me, my name is Austin Marks. I'm currently a respiratory therapist who is pursuing the physician assistant career path. A lot of you probably clicked on this video because of the title, so I'm going to explain that a little bit. Respiratory therapy is a great career path, however there is a downside with it. So I've experienced plenty of deaths. I've seen many things that a typical person doesn't see. If you're a respiratory therapist, a nurse, or someone who works in the healthcare field and you can relate to this video, go ahead and smash that like button and don't forget to subscribe. So I work in a trauma bay and a lot of these things can't be unseen. So like the 12-year-old who shot himself in the head, or the coworker who was in a terrible car accident and now you're doing everything you can to save their life. Death is never an easy thing for anyone. I know myself, I definitely have a different view of death ever since I became a respiratory therapist. I just look at life a little differently. I know one of the hardest things that I have to do as a respiratory therapist is something known as a terminal extubation. So this is when a person cannot live or support themselves without the life support machine, also known as the ventilator, which basically breathes for them. So therefore it's either the patient's wishes or the family's wishes to go ahead and take this patient off of the life support machine. So therefore that's something we have to do as respiratory therapists, is we are essentially pulling the plug. Now this is never an easy task for anyone. I remember my first terminal extubation that I had to do. It's something you never forget. It's definitely an experience. While you're in the room, you also have to keep your composure and try not to show too much emotion, because a lot of times the family members are in there while you're doing it, and they're crying, they're going through some grief right now, and you just gotta go in there and do your job and then get out. Another hard part about this whole scenario is these family members are going to remember your face for the rest of their lives. Every time they think of their loved one, they're also going to think of you. There are some respiratory therapists who have to do this. I personally have never done this, and I don't know how I would handle it. But sometimes a child is in that critical state and they need the tube pulled because they can't live without the life support machine, and it's the family's wishes to not have this child live as a vegetable for the rest of their life or something like that. I think another thing that would hit me is pulling the tube on someone who's my own age, knowing that I could potentially be gone at any moment. I feel like I'm playing with life and death a lot. As I mentioned, we go to all the code blues. So that's when a patient goes into cardiac arrest, so they are officially dead, and we have to start CPR right away and give them breaths and pump on the chest. And they don't always make it either, so I remember my first code, I was definitely shocked. Going back to the kids side of thing, I've only ever been in one code where we had a child. They were 3 years old and they had a disorder known as trisomy 18, which I believe is Edwards syndrome. So therefore the child wasn't meant to live long in this world anyway. However, it was still a pretty traumatic experience. So like the mom was in the room, she was crying, and we were continuing CPR for about 40 minutes, and then we finally asked the mom again, like, do you want us to stop or do you want us to continue doing this for your child? And she said that she came to the realization that this could potentially happen one day because of the child's disorder. So she told us to stop. I mean, there was definitely a sad moment. There were some wet eyes in the room. Some respiratory therapists even work in the neonatal intensive care. So they're dealing with babies who are very premature, maybe sometimes early as 23 weeks, and they don't always make it either. So I know that in my facility, we've had preemies come in and we've had to do CPR on them. Some respiratory therapists even work in a long-term facility. So this is someone who is on a ventilator for the rest of their life, basically, or they have a trach in and they just need essential care. So therefore, the respiratory therapist will make sure that they have the care they need. I did clinicals at a place like this when I was in school. However, I don't think I could ever work at one. This has to be very stressful in a person. You're dealing with patients or people who are never going to have a normal life again. Sometimes these patients are even in a vegetable state. So this kind of reminds me of a story where I've dealt with death. This is something I'll never forget. So I had a patient who was on the floors. He came in for pneumonia. He was originally from a long-term facility. He had a trach in, which is an artificial airway that comes out right about here. But he was still able to talk and whatnot. So I was there doing my thing, and he was my last patient before lunch. So I decided that I could either chit chat with this guy for a while because he probably hasn't had any visitors besides family members or nurses for a while. So that's exactly what I did. I sat with him and I talked to him for about 15-20 minutes. We just talked about football, things he experienced in his life, stuff along those lines. I just wanted to make him feel better because I don't know, it felt right. So anyway, as I was leaving, he told me that he hadn't had a good conversation like that in a very long time. He was getting pretty riled up about football, so I could tell he was definitely excited. So as I was leaving, he also told me that I was a pretty cool dude, so that definitely made me feel good about myself. Well, anyway, about a week and a half later, I was working down in the emergency department. So I was there checking on my patients, making sure everything was okay with them. And out of the corner of my eye, I noticed that in one of the more emergent rooms down in the emergency department, we'll call him Joe. Joe was sitting in there. So I walked over, and as I was walking over, I started to notice that there was a lot of blood on Joe's chest, and it was coming out from his trach, so his airway. So he was coughing up all this blood, and it wasn't like a serous fluid kind of blood, like it was thick blood. So something was definitely going on. However, I've seen much worse, and I figured, okay, Joe can pull this one out. So I talked to the doctor, and he told me to hook up some suctioning. So that's exactly what I did. So I got a little suction catheter, which is basically like a vacuum that suctions everything out. So I suctioned all the blood out, and it just kept coming and coming. So I wanted to make Joe feel as comfortable as possible and make sure that he could actually breathe. So while I was doing this the whole time, Joe was talking to me, and I was asking him how he was and just making small talk. But the whole time he was kind of shaky, and I could tell that he was very scared. Well, anyway, I stayed with Joe for about 30 minutes, and throughout those 30 minutes, I kept looking up at the monitor, and more blood kept coming out. So, about that 30-minute mark, I noticed that his blood pressure was at a significant level, and his oxygen saturation started to drop as well. So I went out, I told the nurse that maybe we should start a morphine drip, or the doctor should come in and evaluate him one more time and just see what the game plan should be. The whole time, the doctor was on the phone with Joe's family, just getting an understanding of what they wanted. And we asked Joe if he would like us to do chest compressions if anything would happen or if his heart would stop. And he told us no, that he would like to die peacefully. So they came in, they started the morphine drip, and I was there, kept suctioning Joe, kept making him comfortable. We talked about football again because I know he got riled up about football. So anyway, Joe was there for about 15 more minutes, and then he eventually passed away. I was the only one in the room when he passed away, but I was with him from when he came into the hospital until he officially died. I definitely kept him comfortable. Held his hand. I wanted to make sure that he knew he wasn't alone. So that's an experience I will never forget. It's gonna be with me forever. So this goes back to the title of this YouTube video, Do Respiratory Therapists Cry? There have been times when I've been sad, however this is the one time I actually did cry. I didn't cry during it, I kept my full composure. I was with Joe. I wanted to know that kept my full composure. I wanted Joe to know that I was there for him, and I was willing to do anything for him. However, after the fact that we called the time of death and they started cleaning him up, I kind of just walked to our little supply closet and was just like, holy crap, this just happened. It's also not just respiratory therapists that go through this. It's your nurses, your CNAs, your EMS, your doctors. Another thing about EMS, they see the worst of it. They go out into the field and they see the initial happening. So they see the car crash when it first happened. They see the guy who just attempted suicide. They see the worst of it, and a lot of times it's only 2 or 3 of them, if that. Our EMS definitely do not get the pay they deserve or the respect. So dealing with all this stress, like, why do this job? Why is it worth it? So as I mentioned earlier, when you save a person's life from a code blue, that's an amazing experience. The respiratory therapists or nurses that work in the NICU and they're with a premature baby who's 23 weeks, who's could not survive on their own. However, you give them enough support, and then you see that baby when they're 3 years old, and they're full of life, full of laughter, full of joy. That's what makes it worth it. We have a nurse in our cardiovascular intensive care unit who loves telling this story. They had a cardiac arrest come in, and they revived the patient. They sent him up to the cath lab, and they did a cabbage times 5, which means they cleared out some of the gunk within his heart because there was a lot of blockage and not a lot of blood flow could go to the heart. So if it wasn't for EMS picking him up, bring him to the hospital, and then all the nurses and doctors doing everything they can to save this patient, he wouldn't have lived for sure. Well, anyway, 6 months later, he walked his daughter down the aisle. And I mean, that is just an amazing story that you can say that you helped someone live to go through that life experience. This is also not a daily thing. A lot of times I'm helping patients, I'm healing them, I'm making them better. Death is something you have to deal with as a respiratory therapist. However, it's not the only thing you're dealing with. Another thing I want to talk about is switching it off. So I'm a huge fan of the ER Forum. I highly suggest that all of you go check out his YouTube channel. Well, anyway, he made a video about the hardest part about being a nurse. One thing he mentioned was turning it off. So what this means is basically you're at work all day and you're dealing with death sometimes, and you're seeing crazy things, and then you gotta come home to your family. So as I mentioned with Joe, I was hurt. I was like, what the heck just happened? And then I gotta come home to my family, to my wife, and act like nothing happened. It's definitely hard. It's definitely a challenge. As the video of his says, the hardest part about being a nurse, that is definitely one of the most challenging things. Some people handle it a lot better than others. I know some nurses or respiratory therapists that this is work and this is family life. There's a brick wall there, and that as soon as they get off work, they're a completely different person. And I'm sure that these people have been working for a while, and that it just comes in time. So this concludes my video. I really hope you guys enjoyed it. This is probably the worst part about being a respiratory therapist, is dealing with the death, the sad part, dealing with the families. It's definitely a challenge. However, there's plenty good that comes with being a respiratory therapist, and I'm gonna make sure that I make tons more videos describing all of that. So make sure you guys like and subscribe, and I'll see you in the next one.